Veterinary Medicine Digital.
We probably don't know the true prevalence of iron deficiency in dogs. The most common causes are intestinal parasitism. However, we suspect that there is another population of dogs that are iron deficient, and in these dogs we can't identify it. And these are dogs that are on nonsteroidal anti-inflammatory drugs, corticosteroids, or chemotherapeutic agents, or all three. And these dogs have other diseases which mask our ability to detect iron deficiency. Iron deficiency is identified by serum iron, serum ferritin, bone marrow aspirates, looking for iron particles. And none of these tests are truly able to identify iron deficiency in dogs that have other diseases. We're trying to develop an assay, the serum transferrin receptor assay, that will help us identify these dogs. If an animal is identified as being iron deficient, then he can be treated either with parenteral or enteral iron supplementation. I would recommend cytology for any mass that's easily accessible for aspiration cytology using a 22 gauge needle. And this includes lumps and bumps in the subcutaneous tissues and the dermal tissues of dogs. There are many situations where you can diagnose benign tumors such as lipomas, basal cell tumors, epidermal inclusion cysts, and sebaceous adenomas, where the treatment would be perhaps surgical excision, but perhaps not. There would be a choice. Recognizing malignancy in these lumps and bumps is important, because then the veterinarian can recommend wide excision of these lesions to the owner of the animal. I would also recommend aspirating lymph nodes, because its cytologic diagnosis is easily done with lymphoma. And it's important to rule out lymphoma because the treatment needs to begin immediately.